Right. Good evening, everyone, and welcome to Medical Mondays with Dr. O. This is an exciting one because it's going to be our last one for this year. I'll repeat this at the end also. Christmas Day is Monday, so we'll be enjoying Christmas next Monday, and the New Year Day is also on a Monday. So, there's no better way to end the year than to bring our very own Dr. Ajagbe again to come talk to us about how this oral health keeps impacting our overall and general health, even headaches and anxiety. I cannot wait to hear this. So without much ado, Dr. Ajagbe, the floor is yours, sir, and welcome.
Thank
you
you.
also, sir. Thank you for filling in for me last week when I was on the plane. Mess up in scheduling. I ended up having to have 2 layovers, and it took me from Monday till Wednesday to get to Nigeria. But thank you for standing in. Thank you, Dr. and Dr. Ajay, because you guys are brains in the background that people don't even know the extent of what you do to get Medical Mondays going. So I want to deeply thank you, appreciate you from the bottom of my heart, as we say in Nigeria. Thank you so much. God bless you all. Thank you.
You're very welcome. Yeah, thank you, Dr. O. You're a trooper. I mean, I'm sure it's going to 1 o'clock. Graduate. I mean, 2 o'clock actually, right? It's 7:15. So you are still up, and I'm sure you still have a very busy day today when the day dawns, right? I mean, in Nigeria already, because it's already past 12 midnight. So tonight, I just want to say thank you to everyone who is able to come and participate tonight. I know so many people probably are busy doing their Christmas shopping, and they're counting down or counting up towards Christmas. But the topic tonight is is a topic that has touched at least every one of us at one point or another. If you've had a headache, whether it's from malaria or from from high blood pressure, or just, not even being able to explain what caused the headache, you know what that means. When one's head is aching, nothing else seems to make sense. So until the headache is shaken off, life seems to be very impossible. Now, most people don't have any clue that there could be any solution that could be meted out through a dental intervention. So tonight I'm trying to bring awareness to this area that may help many people. Many headaches that people have, despite the classification into, basically tension and migraines, tension, headaches, and migraines, we know definitely that in dentistry, there are so many links between the oral health or oral diseases and headaches. So tonight, I mean, I know I don't want anybody to raise hands, but I know everyone has been touched one way or another by this, topic. So, did you know that there are dental procedures that can actually help alleviate headaches and reduce anxiety? Of course, it is true. We know it as dentists, but many people, lay people, would not know that. So let's quickly look into this fascinating subject and explore how dental interventions can make a positive impact on our lives. So let's first of all, talk about the causes of headaches. headache and their causes. That's the subheading that we'll give to that. In order for us to understand how dental interventions can help with headaches, let's first discuss the causes of the headaches. So headaches, as you know, can be triggered or, can have many triggers. And one common cause is related to our mouth, the health of our mouth. For example, many people grind their teeth, but they do not even know that they grind their teeth. So when I see a patient in the clinic, sometimes I'll say, do you know that you grind your teeth? They will look at me funny, like, what? I don't grind my teeth. I said, well, let's get a mirror. Let's see what happens when I show you what's going on in your mouth. And they look at it, they cannot believe it. Many times it will be as though somebody has taken up a file and kind of just file all the teeth, the edges of the teeth, and they are all even. And you can almost put a straight edge on it and say, wow, this is perfectly straight. And they will not admit because they did not catch themselves, grinding their teeth. And many times these are many times this may cause severe tension headache. For some people, it is after they've been grinding their teeth for a while, the height of the bite has altered. Once the bite is altered, it affects the joints, the jaw joints that we call TMJ. TMJ is a big word, it's abbreviation for a long name that says temporomandibular joint. It just means that it is a joint between two bones. One is temporal bone, the other one is mandibular, and the two of them form a joint. And the joint is the reason we are able to open our mouth and close our mouth at will. It's because of the joint that we can yawn, we can chew, we can, drink. Without the movement of the lower jaw, most of these activities that we take for granted would not be possible. So, the discomfort or any kind of derangement of that part of the head can actually result in headaches. So these dental related factors often go unnoticed because many people don't pay attention to it. They just say, I don't know. I just feel a headache. Or I just have a headache. I don't know why. I know they'll give you reasons why they don't think, any of them is even related to their mouth until maybe they will go for another thing, go for another checkup or check something in their mouth, and then there'll be a connection. And then they will now trace it back and see that, wow. So this has been the reason why I've been having a headache. So in order for us to be able to make sense of this, the correlation between oral conditions and headaches, we must bear it in mind that the jaws are part of the skull, a part of the head. And they are the closest, structures in the part of the body that is closest to the brain. So any slight derangement in the mouth will affect the brain, whether directly or indirectly. Another thing that I need for people to understand is this: if anybody has a toothache, one of the signs of toothache, which is an inflammation, which is as a result of infection, will always be headache. They will have, increased body temperature. They will have fever. They will have, pain related to the specific area where the infection is. And the pain usually will radiate out. And most of the time will radiate towards the temple. And that is where the muscle of mastication is really heavy. And so most of the time when they are chewing, it's going to the head and to the side of the head, and the headache will increase. So not only could dental conditions start headaches themselves, but they can actually make headaches worse. They could make headaches worse. Every time somebody has a headache and they're trying to choose something hard, it makes it hard. It makes the head hurt even more. So now, how do we assess the causes from the oral environment in relation to headaches? One of the ways by which we assess, the problems leading, causing headache or triggering headaches or making headaches worse is to do a comprehensive oral exam. And one of the ways by which we do that is just to look into the mouth. Before we go inside the mouth, we ask the patient to open and close, and move their jaws sideways. If there have been any discomfort in their joint, we can take note before we even look inside the mouth. And once we see that there's a discomfort coming from the joints, we will now try to figure out what actually preceded the discomfort in the joint. Now, if the patient had an accident, we can understand that. A patient who had an accident, either through assault, by somebody hitting them on the chin, or they had a traffic accident, whether they are riding a motorcycle or in an auto accident, or just merely falling and they hit their face on the ground, we can at least see the cause and effect from trauma. But if we can't establish that kind of correlation, we can at least look inside the mouth, or we will look in the mouth, definitely, and see the movement of the tongue, the movement of, the cheeks. We will check every tissue and then see if there is soft tissue infection. We know that will also cause some problem. And one of the signs of infection in the mouth, like I said earlier on, is headache. So if there is no infection and the TM joint, the temporomandibular joint is normal and everything else is okay, but the patient still has a headache and we believe that it might be coming from the mouth, we will now check the teeth. First, we'll check the teeth for alignment. If the teeth are all crooked, they are crowded, the upper teeth is, biting on the side of the lower teeth instead of directly on top of the lower teeth, or the teeth of the upper jaw are biting inside the lower, the teeth of the lower jaw. All of these are signs that there is inefficient or difficult, jaw relations. And this in itself will cause problem because the jaws are not lining up at rest the way they should. Under normal circumstances, as you are listening to me, if your teeth are in normal locations and you are not chewing anything, your teeth should not be touching. You remember when, for those who are on this program, when I spoke about the tongue, it's similar to what we're talking about today. At rest, the tongue should rest on the roof of the mouth. At rest, the teeth of the mouth should not touch. So when you are sitting down just watching TV or listening to me right now, your teeth should not touch unless you're making an effort to make them touch. Now, the space between the two arches of teeth is less than 3 millimeters, but they do not touch. And that's the physiological rest of our lower jaw. When our jaw is in that position, our muscles are relaxed, our muscles are not under tension. But when you catch yourself that your teeth are constantly touching, in most cases, it may be because one tooth is longer than the other, or some teeth are longer than the other, and they are inadvertently touching, even though you want to be at rest. So that will create an imbalance in the distribution of forces. When you have an imbalance in the distribution of forces, they will cause pain, not only in the muscles, but in the periodontal ligament. What we call periodontal ligament is where the teeth are attached to the bone of the jaws. That space is kind of like a ligament. That is, there's a connective tissue that's attached to the surface of the tooth, the root of the tooth, and the surface of the bone inside the socket where the tooth is sitting. So now when you put pressure continuously on that, the bone will resorb. You begin to lose bone. And some of this now will cause the jaw relations to be skewed. Once the jaw relations is no longer normal, the problem of the TM joint begins. So now you can see there is really no dodging when there is a problem in the mouth from headache. So now, how do we assess other than just looking in the mouth? I've talked about looking, at the TMJ before opening the mouth, going inside the mouth. We see the soft tissue. We see the alignment of the teeth. We see how well they are arranged or not arranged. And the other thing we now look at is the wearing of the tooth surfaces. All right, for most people who are constantly chewing, particularly those who are chewing things that are very abrasive, their teeth will wear down quicker than those who are chewing fibers. That means chewing things that are not very abrasive. For instance, somebody who likes parched corn that we call guguru in Nigeria. I don't know what they call it elsewhere. They are parched corn. They are when they are roasted, they are very crunchy, very hard. The closest thing that I can say to that here would be things like, chips, like Doritos and all those crunchy, snacks. When you chew on this very frequently, you end up having an increased wear of your tooth surfaces, okay? So you have to watch the amount of abrasive food that you chew on a regular basis. So once the teeth, if we identify that the teeth are wearing abnormally, we know definitely that will translate into some kind of triggers for headaches. Another thing that we'll be looking for are cracks in the teeth. When the teeth appear cracked, many times people will say, oh yeah, my teeth cracked because I was chewing bone, or my teeth cracked because I was trying to, whatever the crunching eyes. Well, anything that will cause the teeth to crack means is an abnormal force, whether it is from a bone or from a piece of crackers or whatever. Anything that will cause the tooth to crack is abnormal force. So, and that kind of force will cause some problem with headaches. So, after looking in the mouth physically, when we talk about clinical exam, we can analyze what we saw. We can say, okay, should we verify this with X-ray? Most of the time, yes, we will do this. Many times we also would do special evaluation by looking at the TM joint, that is the temporomandibular joint, see it on X-ray. Now we have some additional tools by which we are able to, evaluate the problem that may be related to teeth and the jaws. We have what we call the CBCT, that is a cone beam computer tomography. So, it's just like any other CT, except that it's focusing directly on the head. We are able to look at the joint in open and closed position. And also when we ask them to bite down, we can actually also visualize how far the head of the joint move forward. So when we do clinical exam, we can also, add other evaluations to it, like doing the X-rays, 3D imaging, We also have, tools to do to check the, the tension in the muscles. It's similar to what you do for EMG, electromyography, for other parts of the body that has been used by neurologists. We have some special equipment that actually measures the tension in the muscles of mastication, that is muscle of chewing, in the dental clinic. So once we recognize that the potential for headache exists in the mouth, we can now ask the patient for a historical account. Do they keep a diary or a journal of when they have headaches? What seems to precede the headache? This is called the headache diary. If they do have that, it's very helpful, because then we can see whether the headache is, mainly in the morning, or at the end of the day when they have gone through some stressful work environment. For those people who have sleep problem, like having sleep apnea, and they constantly stop breathing in the night, and they grind their teeth. All of these are very helpful in reaching, a diagnosis. Once we are able to establish the cause, we can break the vicious cycle. If we recognize the underlying cause, then we go for it rather than, doing a Band-Aid type of symptomatic treatment. So one of the things that we can then do once we have established the link between oral environment and headaches, we can then decide, to use some standardized tools. One of the standardized tools that exists, that is available for our use, is called, headache impact test. It's called HIT number 6. When you see number 6 there, it only means there are 6 questions being asked on that questionnaire. And the scores, will be tallied, and then be able to say whether the headache, the interpretation of the findings will be whether the headache has an impact in the well-being of the individual, whether it doesn't have, and the severity of the impact of the headache on their daily, existence. So once all of these are gathered and we evaluate everything, we can now try to figure out what kind of treatment options does the individual have. With a clear understanding of the dental issues contributing to the headaches, dentists can provide various treatments, treatment options to alleviate the pain and discomfort. Now, let's try to take a look at the first option that we have to offer relief to any patient who has dentally related headaches. The first one is the customized mouth guard. It's been given so many names. Some people call it night guard, some people call it bite guards, some people call it mouth guard. But it's simply an appliance that is custom made for every individual. It's custom made in the sense that the mold of the mouth is made, and a vacuum machine is used to create a device over the mold of the mouth of the individual. That device cannot be interchanged. You cannot share with your friend. You cannot use one for the whole family. It has to be done for each individual. So that helps to prevent, or to kind of break the cycle, the vicious cycle of grinding and clenching that is causing the headache. Another thing that we can do, particularly the first device, is for those who have the tension, tension type of headache, which is related to clenching, grinding because of the muscle activities and the abnormal force distribution that causes the muscle to ache. Once we give that device, most patients will have tremendous amount of relief. So that is one of the first line of, treatment that we present to patients that have headaches that are connected to oral discomfort. Now, the second treatment option that we have is the occlusal adjustment. This is the one that is related to migraines. I know there are people who have no idea how migraines begin. They just know that they have migraine, and they just say, oh, once the migraine is coming, I have this, prodromal, signs that I smell something. Or some people will say, oh, once there's bright light, their head begins to hurt. But many people will admit that their migraines often start when they are experiencing some stressful situation. And in dentistry, we have found a correlation between a stressful event, which precedes clenching of the jaws for a long period of time, that they are related to the onset of migraine. And most of the time, it's not just that they are clenching, but because their teeth are crooked, their teeth are malaligned, the abnormal forces that I was talking about earlier on, the abnormal force distributions, actually as the trigger for the migraine headaches. Now, many patients have been helped tremendously just by identifying this situation as being related to their dental condition, and by adjusting the occlusion, that is how the teeth relate, we can actually remove the triggers for their migraine headaches. A lot of patients have been very much helped by this approach of treatment. For some patients, particularly those who have very severe, cases of malocclusion and crowding, they cannot really just by having occlusal adjustment be relieved. They have to have their teeth aligned, because the poor bite that is resulting from malocclusion or poor bite alignment cannot just be wished away or by just adjusting the contact points and the contact spots on the teeth. The teeth have to be aligned properly so that the forces of chewing can be transmitted in the right direction. The forces should be vertically from the upper teeth to the lower teeth. The forces should be transmitted along the long axis of the teeth. And that's the reason why the teeth don't crack. When you chew normally, you will not have any abnormal force transmission. But when the teeth are not lined up properly, some of the teeth are lined across towards the tongue, some are lined outwards towards the cheek, and all of those are creating horizontal force transmission instead of vertical. And once that happens, just biting a simple, a tiny piece of bone from, say, for instance, things like a pork chop or steak can actually cause the teeth to split in two, just because of the bad alignment of the teeth. So we need to bear this in mind. If your teeth are not well lined up and you have been managing it, you might have been suffering, silently for a long period of time. And by realigning your teeth and putting your teeth in the right locations may relieve most of those muscle problems as well as migraine headaches. So orthodontics will be one of the treatment options that we consider. Now, when we talk about orthodontics, it's no longer just the wires. I'm sure many of us, when we talk about orthodontics, we say, oh, no, I don't want those kind of kind of braces in my mouth. Oh my gosh, it looks ugly. And some people have many tales of woes about how they bite their cheek and all of the inside of their cheek is chewed up because of the wire and the brackets. Well, there are options now. Technology has advanced so tremendously that we can move people's teeth now and align their teeth perfectly using clear aligners. There are many different kinds of clear aligners now, but the technology is similar. Some are more refined than the others, but I can tell you, you get what you pay for. So if you want to do the one that you do it by yourself, you know you are not going to have as much supervision. You know, you're not going to get the same kind of outcome as somebody who goes to see a dentist who is directing the treatment. So orthodontics should no longer be something to be feared or to be afraid of, but, you know, something to be embraced so that you can get the perfect health that you deserve. Now let's go on to the other aspect of the talk today, and that is managing anxiety. You know, I'm sure out of those of us on this, call tonight, there are many that probably don't want to go to the dentist because they are just scared. They are just petrified. The thought of going to the dentist just makes them like, oh my gosh, I don't want to go to the dentist. Well, there is help. Every time you need to go to the dentist, if you are going for wellness checkup, there's really nothing to be afraid of. If you have no cavity, you have no gum disease, you have no toothache, you have nothing that should be, you know, that keeps you awake at night. When you go for a dental checkup, it is easy. We take a look in your mouth, we do x-rays, we check your x-rays to be sure that your bone level is normal. If you are losing bone, even though your teeth look clean, we can tell you where your bone used to be and where your bone is right now. When we do that, we just use that to motivate you, to show that if you think you are doing an excellent job, think again. It looks like you are not doing so much, as much an excellent job as you thought you are. Because when you see bone loss just doesn't occur willy-nilly. It occurs, bone loss usually occurs in response to certain abnormal stimuli. And one of them is abnormal pressure if the teeth is not lining up properly and the force is pushing the tooth against the bone will melt away in that direction. If it is as a result of gum disease, chronic gum disease, or chronic accumulation of tartar buildup, will also force the bone to resorb. Resorption means melting away. So, so when we're talking about fear and anxiety related to dental care, you should avoid allowing yourself to be pushed away from the help you need because of anxiety or fear. In the dental clinic now, there are many, strategies that we have in place to help people who really have phobia or who have fear of dental visits. One of the things that we do is to actually just communicate and educate the patient. That is so fearful. For me, usually about 10 to 15 minutes I devote to any new patient that I have to find out what their fears are in coming in for that appointment. And almost 100% of the time, the patients who came in totally nervous, some of them perspiring, profusely, you could see them really traumatized just by going inside the office and sitting on the dental chair. That sometimes I have to tell the assistants to get wet napkins to put on the forehead of those patients until I've really spoken to them and tried to diffuse every single cause of fear that they had before we can proceed. And many times, if they are not easily persuaded that there should be nothing to be afraid of, I will have to reschedule that patient, particularly if they need something that requires an extended period of time for treatment, because they need to be mentally prepared to come in to have their situations rectified and helped. So communication is a very, very important part. Education, education, education. Once you know that what I'm going to do for you is not something to be afraid of, and I can demonstrate it to you that this procedure is not something to be afraid of, most of the time the patient will just sit down and say, okay, doc, I trust you. Okay. And then at the end, when everything I said to them panned out, wow, they don't want to leave anymore. They're now high-fiving me. They want to come back and tell everybody, oh my gosh, you are just the best. Wow. And that's the kind of thing that you expect to see when you are able to persuade the patient that what has been driving them away is nothing to be afraid of. For those who have real pathological fear, we have other strategies. We could do sedation. Say, for instance, somebody who has real bad infection, and we've treated for some days with antibiotics, and we know we have to get rid of the source of infection. We can, sedate them, either giving them oral, medication or IV, sedation, or we can actually, in some cases, refer them to the hospital to be done under general anesthesia if their fear is that bad. Some patients will say, look, I don't even want to see anything. I don't want to hear anything. I just want to be out. But most of the time, we want the patient's feedback while we're treating them. That's why we don't put most patients to sleep. Some patients have become hooked on laughing gas. So I stopped giving laughing gas because some patients will just come just purely because of that. Dr. O might be able to testify to that some patients just come in just to get pain pills. They don't need to come in, but they just pretend. They tell you, oh my gosh, the pain is killing me, because they just want to come in so you can give them a prescription or refill their prescription. The same thing we've been seeing in dental offices. Patients will come in, they pretend like, they cannot stand. No, I can't even look at the needle. No. You have to put me to sleep, or at least give me laughing gas. Because they've been hooked on it. They want it on a regular basis. So I try to tell the office staff, no, we're not going to be giving, laughing gas as a regular, normal standard procedure anymore, unless it is absolutely necessary, particularly for children who, cannot sit still. And the only thing that we can do is we don't want to give them heavy medication to knock them out, but we can give them laughing gas to kind of mediate them to sit still and become very cooperative. We also use some kind of technological devices now that we call distraction techniques, either through music, through virtual reality. We give them headsets. We give them something that even some, by watching movie, they're totally distracted from what is going on around them, and that helps us in helping those patients who have so much anxiety coming to the dental office. And when everything else, that we have to offer doesn't seem to help any patient, well, I haven't really done much about declining treating a patient, but if that is the last resort, I would decline and just refer the patient, to the hospital, particularly where they have hospital-based dental practice. And that way they can admit the patient or at least use general anesthesia to see the patient. So I hope I've been able to bring some things to the limelight tonight. So in conclusion, I can just say that dental interventions are valuable solutions for managing headaches and anxiety caused by dental issues. By assessing the underlying problems, dentists can tailor treatment plans to address any patient's needs, from custom mouth guards and occlusal adjustment to orthodontics to using treatment management and treatments to manage anxiety using all the distraction strategies or techniques, as well as using medications to sedate the patient. So at this point, I will stop. And if there are questions, I think we'll be able to dialogue and interact on those questions. Thank you very much for your attention.
Thank you so very much, sir. Whew, I remember that grinding, but we have some questions.
Right. Okay.
Attorney Williams asked if it's not good practice to chew on bones.
Well, it depends on the kind of bones you want to chew on. If you want to chew on very soft end of the drumstick, for instance, the bone from the drumstick of a chicken or turkey, and your teeth can crush it without any strain. Of course, you can chew it if it's soft. Now, if it is very hard, I would not ask anybody to try to crush a goat leg bone, for instance, with their teeth. Now, I'm sure there are some people in Africa that will say they are bionic. They can use their teeth to crack anything. I would not advise that to be the case. If you know this bone is not soft enough, please don't try to crack it, because in the end, you will crack your teeth. And cracking your teeth is not a very pleasant experience. I can tell you it is the most harrowing experience that anybody could have, particularly when you are enjoying a meal and you crush a bone and it cracks your tooth right in the middle. You will not enjoy that meal any longer. So my advice is, please choose your battle wisely. If you want to battle the bone, please choose the one that you can conquer. Don't choose the one that will conquer your teeth, please. Yeah.
In follow-up of that, before I ask the next question, people actually say, and it could be a myth, that chewing bones actually strengthen your teeth.
Yes. That's
that
what
true?
Okay. The truth of it is anything tough that we chew on strengthen the teeth. But the balance has to be maintained. If you say, okay, hard bone is good, but hardest bone is best, it is not working that way. It's not directly correlated that way. Chew the ones that you can chew. Don't chew the one that will crack your teeth. That's the point I'm trying to make. Yes, chewing anything, even chewing stick, sugar cane, tendons and ligaments, from meat, or pieces of meat that are not overly cooked, too tender, too soft. All of those are very helpful in making sure that your periodontal ligament is very strong. Your teeth will be very strong. I can use this to crack a joke. In many dental schools here in the US, where, they have patients for students, many times they have a Nigerian, or a Jamaican come in and need extraction, most students will have to dodge because they've seen some difficult extractions and they are always from a Nigerian or a Jamaican. So many times when I was at Howard, they will call me to come and assist because they say, okay, you have an idea of what to do with this. And once I use an elevator, I'll take the tooth out. Because that's my experience back in Nigeria, not coming to the US. So chewing anything hard is very helpful. And I don't want to mention, ethnicity, but those who chew sticks, they chew sticks all day long. They're chewing stick everywhere. They're spitting, chewing, and chewing. If you look at the teeth are white and strong, but the teeth are worn down. So you have to maintain a balance. Chewing bone that is chewable is healthy. Chewing bone that will crack your teeth or that's so abrasive that will wear your teeth down over time is not very helpful. So you have to maintain a balance.
Thank you so much, sir.
You're welcome.
There is an advice here, or Herman asking a question here that I'm not too sure what it is. It says, any advice on root channel treatment? Is it a root canal?
Root canal, yes. Root canal is what he's trying to say.
Okay. I think that's the British way of saying it.
Root what? Root channel? No, it's root canal. Canal is canal.
Root channel treatment. Okay.
Right. Okay, so is there an advice for that? This is my own personal opinion, okay?
Any advice on...
Dr. O, you are freezing. Any advice on root canal? Is that what you're saying? Dr.
I believe so. That's what the question says.
Okay. So
that's what I'm sorry, it's my internet here. Sorry about that.
Okay, don't worry. Okay.
Then, Mr. Lawal, you would ask your question after this one, sir. Welcome, sir.
Mr. Herman Irish, right? Is that the person that has the question?
Yes. Yes.
Okay. So root canal usually is one of the treatment options that we offer when a tooth is dead or dying. Okay. Why should a tooth die? A tooth can die from chronic infection. That is, you have a cavity in a tooth, and that cavity has gone to the nerve, which is in the center of the tooth. The core of the tooth is a neurovascular bundle. That is, it has nerve and blood vessels and connective tissues. Now, when the infection gets there, the wall is so tight, the wall is rigid. So unlike the skin, when you have inflammation of the skin or infection of the skin, it will swell up. But in the case of the tooth, the walls are rigid, so the tissue cannot really expand. And when the little swelling that can occur in the core of the tooth, which is what we call the pulp tissue, will cause the nerve endings to be so agitated so that the toothache that comes from that, it is amazing. Patients cannot sleep through the night. And sometimes it looks like the tooth wakes up at night to really torment them through the night. They wish they could take the tooth out immediately, but many times when they come to the dentist, we tell them there are options. Now, if the tooth is not badly decayed, that requires to be taken out immediately, we offer the root canal. The root canal is just to prolong the life of the tooth in the mouth. It is not a permanent definitive treatment. It's just something to move the tooth along so that you don't lose that tooth prematurely. But most of the time when we clean it out, when we clean it out, it's like hollowing out the egg. When you now take the egg out of the eggshell, what happens to the eggshell? is very delicate. You press against it, it can crack very easily. The same thing with the root, with the tooth that is treated with root canal therapy. Anything you put inside that root canal becomes like a wedge. And you know what happens when you're trying to split a wood and you put wedges in? You hit the wedges in, you can split a big trunk just by tapping the wedge slowly and consistently until the tree or the wood split in half. The same thing happens with root canals. So should you do root canal? Yes, if you want to prolong the life of your tooth, existence of the tooth in your mouth, yes, you can explore that. But like I said, it's not a permanent definitive treatment. For most root canal treated teeth will eventually be extracted. So it's just a matter of when do you want to take it out? You want to take it out now or you take it out later?
Thank you, sir. So there's another, Mr. Lawal has his hand raised. Go ahead, sir. You can unmute.
Okay. Good evening. Thank you.
Good evening, sir.
Thank you, Wole. By the way, I like your cap. I know where you get them from all the time. You have all these custom-made, nice-looking caps. Okay, Wole, thanks. My question is about the reference you made to alignment. The modern technology for the teeth alignment. Are you referring to the Invisalign?
Yes, Invisalign is one brand.
Okay, well, I want to ask you, how effective is that? Is it good enough to be reliable indefinitely, or you have to redo it after so many years, especially for adults?
Thank you for that question. It's a very important question. Technology has moved along so well. There are different brands of aligner technology now existing. There is no one standard for all, in the sense that as the technology evolves, each brand is improving on what they started with. To answer your question succinctly, I can say that yes, the treatment using aligner is reliable. And remember when I was presenting, I mentioned that you get what you pay for. If you pay for the cheap one, of course, don't expect, the same kind of outcome. Don't expect the same kind of outcome from those who are paying premium for their treatment. So I think Dr. Wu is trying to say something, right?
No.
Oh, okay. Some voice was coming in.
I'm muted.
Oh, okay. All right. So, yeah, Yomi, what I'm saying to you is that, yes, it is reliable. If it is done properly, you will not have relapse. Okay. I am moving away from Invisalign, and I'm not talking about brand. I'm not peddling any brand. I don't have any special interest or payment or promotional stuff from any brand, but I'm moving in the direction of an aligner that doesn't require what we call the IPR. IPR is a shortened form to say interproximal reduction. That is, when you see two teeth like this, let's say they are overlapping, but we want them to rotate into the right position like this. When we in Invisalign, one of the procedures is that between these two teeth that are touching, that are overlapping, I want them to line up properly like that. I will put a strip, an abrasive strip, that will strip off very thin layer at a time from each tooth. So in effect, you are reducing the size of the tooth, of each tooth. For me, I really don't like that. It works, but I don't want to damage a healthy tooth just because I want to move it.
Mm.
So new technology exists that you can actually move the teeth without doing that. So I'm moving more in that direction. So that's what I'm trying to say. But
So if I may
this,
ask, what is that called? What is that called?
Which one?
The one that you're referring to, the one that you said you would rather use beside the Invisalign.
Well, I don't want to sound as though I'm promoting a particular product. That
Okay,
one is called the Candid Pro. Candid.
Pro.
Yeah.
Okay. All right. Thank you. Really.
Okay.
Yeah.
You're welcome. Okay.
So, thank you so much. There's another question from Hammond. Any advice on mercury fillings and the general safety with our general health? That's an excellent question.
Okay.
There was a time all we had in the 70s, 80s, all we had was mercury fillings.
All right. Thank you for asking that question. Although, yes, that can also cause headache for some people, because some people have read all kinds of stuff to say that, oh, all their problem is caused by the, amalgam filling in their mouth. Oh, they have this. Even some people are relating it to multiple sclerosis. So they kind of link it to all kinds of things. Oh, somebody is having mental issue. They believe it has something to do with their amalgam filling that they've had for years. Well, I can say one thing for a fact. Amalgam is the strongest and the most durable dental restorative material. If it's done properly, it can last a lifetime. If it's done properly and the patient can maintain it, no recurrent decay around it, that amalgam will be there forever, that the patient has the mouth and is alive. Now, the problem with amalgam is not in the mercury. Because once you have amalgam made, for those who do not know how amalgam is made, we have the powder like iron filings. That is an alloy. You have a mixture of metals. Then we have liquid mercury on the other hand. And when we want to prepare the filling material, we add some mercury drops into a container, and we add this a metallic powder. We add them together and we mix them. When we mix them, they become consistent enough to be molded. When we mold them into the tooth, into the cavity that we just cleaned out the decay, we've now packed them tight. We pack the amalgam very tight. But because of the chemical interaction between mercury and those metals, it will harden. It will become so hard that you cannot just tap it and break it. So that is why it is the restorative material of preference for decades. I don't want to say centuries, but so let's just say decades. Now, new materials are coming out that, they are not as strong as amalgam, but they are moving closer enough to be strong enough to replace amalgam. When amalgam is in the mouth, it is safe. I can say that categorically because from the metallurgy that we learned, anytime you have mercury underwater, mercury is safe. Because mercury is heavier than water, it will always go down. And whenever you have water covering mercury, it does not get into vaporize. It will not vaporize. It will not get into like a vapor. To have water on top of mercury is the reason why mercury is safe in the mouth, because your mouth is not always dry. Mercury, there is no free mercury in the mouth that is coming from the amalgam. The metal filling does not release mercury into the mouth because what we call the trituration, that is when we mix the two together, the mercury liquid and with the powder metal filings, once we mix them together, you cannot get the mercury out by itself anymore. The only time it was said to be dangerous is when if it's too wet, that is, you have too much mercury in the mix. It is the dentist that has exposed himself to danger. It is not the patient. Because the dentist now has to squeeze off the excess mercury out of the mix. And we have a special piece of cloth that we use to do that. We will squeeze it, but we have to have our gloves on. We will squeeze it, but we squeeze it into a jar of water. So once the mercury is under the water, the mercury is now going to go into vapor. And the only dangerous part of mercury is the mercury vapor. If you inhale a lot of mercury vapor, it's going to cause what we call acrodynia, which is a disease it's a systemic disease that manifests also in the mouth. So I would not want to belabor the topic or take it too far into any other thing. But amalgam, if you have an old amalgam that is still good in your mouth, I would say leave it alone. But if there is recurrent decay around it, and you can see it staining all around it, and part of the teeth are breaking off around it, well, it's time to do something about that too. So I hope that answers your question, but if you still are not clear, I might be able to explain it if you have another question.
I think, thank you. I think that was very clear. There's a question here from Abby. Abby, your sis, my sis. She said, interesting, that she assumed chewing gum would weaken the gum.
Mm-hmm.
When
Abby,
you talked about chewing,
mm-hmm.
Okay, you got it.
Abby,
okay.
I'm about to tell you, chewing gum does not weaken the teeth. Mm-mm. Actually, it makes the teeth to be stronger in the jaw. The concern that I have about chewing for too long is the effect on the joint, long term. Anything that you overuse will have a problem. We are not meant to be chewing 24/7. We should take breaks. And that's why the meal times are broken, in such a way that we don't chew all day long. So if it is possible, take a break from chewing gum. You will, your teeth will be stronger when you chew anything at all. If you chew anything that resists being swallowed, it will strengthen your teeth in the bone. My concern with those who chew gum all the time is they wear their teeth down very quickly. And when you wear your teeth down, your bite adjusts to that. If your bite used to be this high, when your teeth are wearing down, it's going down like that. And when it's going further down, when your teeth are like this, when you bite together, your nose is pointing to your chin now. And that is an abnormal location. It's going to affect your TM joint long term. And it's going to cause headaches. So many people that have their teeth worn down to the gum line, unfortunately, they have to now wear dentures. They can no longer have good occlusion because their teeth are gone. They're like they don't have any teeth in their mouth anymore. But because the teeth are still in the bone is still strong. Rather than taking the teeth out, we can just make an overdenture. We make a denture over those teeth, and then they now we build back the height of their bite. Now we restore the joints to normal and the patients can feel happy again.
So with the chewing gum, I will be concerned also about the sugar content. Even in the, sugarless, say, gums that have all these other things like saccharins and stuff that one should not be eating. Even high fructose corn syrup can be found in there. So
yeah, I mean, you're right. Anywhere that you have a refined carbohydrate, you expose the individual to the potentials for gum disease and cavities. Because anytime you have plaque accumulation not only causes cavity, it also causes gum disease. So if you're chewing any of these things and you are able to maintain good oral hygiene, you should be fine. I'm not saying that you should not chew anything at all just because it has sugar. There's really nothing we can do without taking in sugar. We need sugar for the body function. The muscles, that's their food. They need sugar. The brain needs sugar. So there is no way we can truly, totally avoid anything carbohydrate. We need it. So if you are going to chew gum, don't chew all day long. Just choose the time that you want to chew it. And then take a break, because you don't want to wear down your teeth very quickly to adjust your jaw joints and then create more problem for yourself. If the reason you are chewing gum is for bad breath, well, you can mitigate that too, not by chewing for extended period of time, but by using totally different dentifrice. And I've said it several times on this platform. Use baking soda and hydrogen peroxide. Wash your mouth, you'll be clean. You will not have as bad breath as if you use any other toothpaste. I'm not fighting any toothpaste manufacturer. I'm just saying from my own observation, and I think I've had enough experience in dentistry to be able to say some things categorically. I've said I've been using baking soda and hydrogen peroxide for at least 15 years. The moment I decided, wow, what's the reason for me not using this all the time? And I've had a very good experience, and I've had other people that I just mentioned it to, they come back to me and say the gum disease that they've been battling with for years, the moment they switch to baking soda and hydrogen peroxide, it's like they just get the relief of their life. Like, wow. It doesn't mean that the damage can be rectified just by using baking soda and hydrogen peroxide. It just means that you will stop it in the tracks so it doesn't get worse. So that's what I'm trying to say. If the person chewing gum all day long is chewing it because of breath issue, then you can modify it. Use baking soda and hydrogen peroxide to brush and chew maybe, when you are not going to be talking for too long, and you are going to eventually be talking to people after a break of, not talking to people, and you think your breath will stink, you may just intervene by doing that for that period of time, but don't chew all day long.
Thank you. So Dr. Damien has a question.
Mm-hmm.
It thanks you, though, for the valuable dental information and asks for, it says, for overcrowded teeth due to hereditary causes, is it wise to do selective extractions?
All right. I would say it is best not to do any extraction at all. Now, because we didn't know that there is help for people with severe crowding, now we know there is help. I've talked about the appliances on this platform several times, and I mentioned the Vivos appliances. The vivos appliances are the ones that we call DNA and mRNA appliances. They are not related to genetics, but they're just acronyms that are similar to the genetic materials. The DNA means day and night appliance. The mRNA means mandibular, repositioning appliance, night appliance. So that one, mRNA, is used in the night to move the jaw forward so the tongue does not fall backwards, while the DNA is day and night. That is, you wear it in the evening and through the night. You don't wear it during the day when you are going to work or to school. You don't use the appliance during the daytime. You use it in the evening before you go to bed. So you use it basically like maybe 12 to 16 hours, depending on how much time you have in the evening before going to bed. So we can use that to grow the jaw. Every human being that has 32 teeth has the potential to grow the jaw to accommodate all the teeth side by side without overlapping. But like I said before, if you as a child, you didn't have enough breastfeeding as an infant, or you have very sparing breastfeeding, and then the baby is weaned from not breastfeeding, bottle feeding into mushes, like a GABA baby food or food that are ground down for them, up to the age of maybe almost 1 year old. And all of those are affecting the development of the jawbone. It's affecting the development of the tongue, affecting the development of the roof of the mouth. And all of that are the reasons why the teeth are crowded, because the jaws have not been fully formed. Now, we are improving that by giving children in America chews. There are some manufactured chews now that they give to babies or children to chew on to stimulate their jawbone to grow. So the things are moving forward. What Africans are doing on a natural basis, because that's all the default, that Africans have chewing stick, sugar cane. They have everything tough. When you give a baby sugar cane, he knows what to do with his teeth. You know what I'm talking about? And all of those activities of peeling the skin of the sugar cane is toughening the teeth in the jawbone. Anything that exercises the teeth will cause it to grow. Now, if an adult has crowded teeth that's not been intervened for a long time, and the bone loss is very tremendous. That is, for those who have their front teeth all crowded up like that, and the one that is leaning towards the tongue is already loose, you really cannot make it stronger. It is done, because all the bone that's surrounding the root has been melted out, because the tooth, remember when I was talking about the vertical forces, if the forces are against the side of the tooth, all the bone under the tooth will be melting away. And that's the reason why there will be no recourse. That tooth will have to be taken out because it's already loose. But if you are saying everything is healthy and you are thinking about selective extraction, I would say I wouldn't support that. If there is any option, any additional option, I will explore the other option rather than just taking the teeth out.
So thank you so much. Dr. Damien went further on the, amalgam fillings.
Okay.
He said, your explanation of amalgam fillings and mercury is consistent with scientific explanation.
Mm-hmm.
Can mercury be released, though, when the amalgam filling is being removed to replace it with composite material?
Well, generally speaking, remember the mercury is no longer free. The mercury that is in the amalgam is not free mercury. So unless you put it in a furnace, that will almost melt out all the other component alloys in order for the mercury to be released. And the mouth is not going to get to that temperature. It's not possible. So there is a there's a commercial way to extract mercury from old alloys, the old amalgams. So let's say we collect all the amalgams that we are removing from everybody, okay? We're cutting around the amalgam, we're removing the amalgam, we're putting them inside a jar, we'll send them to a factory where they can extract the mercury from there. And the only way to do that would be to actually take it into a furnace. They will first of all disintegrate or melt away the other metals, and mercury vapor would now be condensed down into mercury liquid. So there is no way I can generate that amount of vapor in removing an amalgam in a patient's tooth. It's not possible. Now, there are those who want to be, antagonistic against any particular product. They will go to any length to try to do, explain something tangential to that as to support their claim that is dangerous. So I will, on my, from my own experience, I don't know whether I'm the one with the longest experience in dentistry on this platform, but at least I've been practicing dentistry for 43 years. So at least I have a little knowledge about that.
Thank you. That is something that a lot of people ask questions about, that removing of the mercury, if they're going to be exposed. Thank you so much for that explanation. Haman echoed it that he appreciates your answers tonight on his questions. It says, Dr. A, that he has never had as full an explanation for them in the UK.
Yeah, because there's no time. Time is money.
It will commit them to memory.
Yeah, besides, they do it in such a way that it's difficult for any dentist to truly have enough time to explain anything to any patient. So it's all about time. How much time do I have with this patient? You have 10 minutes. So any explanation that would take 15 minutes cannot be done. And it's not because the dentist doesn't know, but because the dentist cannot afford that time because other patients are waiting. And so is a vicious cycle. Another thing I just wanted to mention real quickly about the amalgam is this. Remember I said, anytime mercury is underwater, there will be no vaporization. Whenever a dentist is removing amalgam in the patient's mouth, we have copious amount of water. The drill is going with water everywhere. The slurry is being vacuumed immediately. The liquid is not being swallowed by the patient. The liquid is being suctioned out immediately. As the thing is coming off, the suction is picking whatever is spinning off of the drill. And it's going by vacuum into a reservoir that is waterlogged. So there is no way I am going to be releasing mercury into the mouth of my patient. It's not possible. The technique is such that it does not allow mercury to escape.
Thank you. So Abby said, could the wearing down of the teeth due to over-chewing cause teeth grinding?
Well, somebody who is already grinding their teeth, either because they are not sleeping well because of sleep apnea or because of stress, daily stress, they will use the chewing to kind of mask they are grinding. Because that's exactly the same thing they are doing, but they're just masking it. They are chewing now, but the fact that they are having chewing gum between their teeth reduces the impact of teeth against teeth. You understand? But it doesn't reduce the fact that they are still grinding their teeth. The only thing that the gum is doing it is reducing the friction between the teeth surfaces. So if you are chewing only on one side, the other side that doesn't have gum is still touching each other. You can't avoid it. And as long as, if you are chewing like this, straight down, without grinding, without lateral movements, you won't see much wearing of your teeth. If all you are doing like crocodile is this, just going down, up and down, your teeth will not wear down as much as when we are chewing. You know that the chewing is a complex activity. When we are chewing, we're not just chewing like this. We are chewing like this. We are chewing like this. Every direction possible is being, used when we are chewing. Now, the way you chew Tootsie Roll, for those who know Tootsie Roll, is different from the way you chew, the chocolate on Snickers bar, for instance. You're not going to use the same amount of force to chew a Snickers bar, even with peanuts in it, as you would when you are chewing Tootsie Roll. If your teeth are not strong, don't chew Tootsie Roll, or you end up with no teeth in your mouth, because the Tootsie Roll is a big extractor of teeth. People with their loose teeth will just have no tooth in their mouth.
Wow. Thank you so much, Dr. Ajagbe.
You're very welcome.
On the platform, there have been different comments on what people have learned tonight. So, Haman says, thanks for the presentation, that it's most insightful and much appreciated.
You're very welcome, sir.
Thanks for that clear and concise explanation, Doctor, on the root canal. And he says, Dr. A is looking dapper casual today and well color-coded.
Thank you.
Dr. O is gracefully casual as always. Thank you, Haman. Thanks for the valuable dental information. Thanks for your answer, Dr. A, regarding his question on mercury fillings. And already, told you how Dr. Damien feels and his appreciation of your presentation.
You're welcome.
Attorney Richard Williams says, thank you, Dr. Ajagbe, for the excellent presentation.
You're welcome.
And my sister Abby private chatted me asking if I was sleeping, I should wake up. So Dr. V said, thank you as always. And great to see you too, sis. You were late. Thanks for the mission, she says. God bless you and the mission team. Yeah, she was. I was looking for her. Dr. Damien says he's a dentist of 34 years experience. Did ask the questions for public information. He asked the questions about the mercury and if during extraction, if you
during filling.
No, during even the removal of it, if you can be exposed. He asked it for our purpose, you know, so that we can gain that knowledge
I got
that,
you.
you don't. Yeah. Thank you so much, Dr. Damien.
Mhm.
My big brother Tai Doherty said, thank you, Dr. Jagbe, for the wonderful presentation.
You're welcome,
And
sir.
Dr. Kukwala said, thank you, sir.
You're
And,
welcome.
you know, thank you so much. That was awesome. Who would have linked, you know, oral issues like biting is what you call it, right? To headache, but it is real, it is true. So we thank you very much for this presentation.
You're very
And
welcome.
before you give us your closing remarks, I just wanted to wish everyone a very Merry Christmas and a Happy New Year, since we're not going to be seeing again till 2024 by the grace of God. And I pray that the Lord will keep us all safe into the new year. Dr. Izugu said, excellent job. And my sis says, amen. So Dr. Jagbe, your closing remarks, please.
Well, I think the easiest thing to remind ourselves about is that there is no part of the body that can truly be segregated. Every part of our body is connected, but some are more connected than the others. It is not by chance that the mouth is close to the brain. The mouth is close to the brain for so many reasons. But one thing that we need to realize is also that the proximity of the mouth to the brain shows that anything that affects the mouth can affect the brain so quickly. I'm talking in terms of spread or direct connection. So we have realized that now, that when people claim that they have headaches, many people will not look at their mouth as being potential source of the headache. They will look everywhere else except the mouth. Because they will say, well, I still eat my food, I still chew my food, but they never will imagine that they are crowded teeth or one missing tooth that allows another tooth to lie across will actually be the cause of their problem. And unless they go to seek help, they can never find that out, or they will just be suffering indefinitely until somebody will find them and give them such awareness and then intervene, and then they get relieved and say, oh my God, where were you? Where have you been that I didn't know you before this time? So it is imperative that you check, go for dental checkup, just go for wellness checkup. Don't wait until you have toothache or you have some serious problem. You have cracked tooth or you are enjoying stockfish and something happened, and then you say, oh my gosh, I need a dentist tonight, and then nobody's opened. Don't wait until that happens. So just go for a checkup, and then if you have a clean bill of health, that's fantastic. I tell my patients I have very good oral hygiene. I say, my goodness, you are doing an excellent job. And if I look at the x-ray and it ties up with what I'm seeing clinically, I applaud them and make them feel so proud of themselves that, look, you are doing a great job. Most people are wasting time by ignoring their teeth. I tell people again that if you ignore your teeth long enough, they will go away. And one of the ways to ignore your teeth long enough is to keep chewing or grinding your teeth and not paying attention to it. It's just negligence, because if you are grinding and you're not seeking help, well, eventually you will come back to roost. So please, the teeth are not just walking by themselves. You are the one carrying the teeth along. And so the whole human being is who we need to treat. We need to help everybody the whole human being to feel good, to be healthy, and then have an overall well-being. So that's the whole point of this discussion. It's not just that dentistry and headache can be correlated. No, it's just that the human being can live a healthy, well-rounded life. And if anxiety can cause people to grind their teeth, it will affect everything else. It will affect their head, it will affect in fact, somebody who has migraine doesn't want to interact with anybody. You say, look, I don't want to talk now. I don't want to see anybody. Please turn every light off. I don't want to hear any sound. Some people is that bad for them. And then when we find out that it's because of the way their teeth are, and we adjust their teeth, and they say, my goodness, I never had any more, migraine since the time you did my teeth. Wow, what a miracle. Well, thank God for that. It's knowledge. That's why we're trying to do the awareness. This whole talk is about awareness. And so if you have learned anything today, thank you for your attention. If you're still battling with understanding, if you still want to talk more about it, maybe when everybody else is hanging up, you can stay on when the recording stops. We can still kind of evaluate some things for you. But remember, we are not establishing any kind of doctor-patient relationship where we can disseminate information. Thank you.
Wow. Thank you, sir. Here, Mr. Duarte wishes everyone a happy holidays, and you will be surprised. Just think of my surprise when on the mission field in Nigeria, somebody just grabbed me and hugged me. And I love hugs. And I hugged back and looked up, and it was my cousin, his wife, Mrs. Duarte, all the way from California with my niece on the mission ground. And they said, what can we do to help? I'm like, what are you doing in Nigeria? I didn't even know they were in Nigeria, but they showed up at HDPTC for the missions. In case you guys don't know, that was where we had the mission trip at the HDPTC, the cardiovascular, state-of-the-art cardiovascular clinic that Dr. Izugo started in Oshodi in Lagos. And, so I got mom to do admissions, and my niece went to pharmacy. And she loved it so much. When it was time to leave, she was not ready to leave. So we did have some people from California and my niece from New Jersey come over to assist at the mission field. So other comments here says best presentation on oral matters that he had ever experienced. Merry Christmas, everyone. Merry Christmas to all. Merry Christmas all, and a productive 2024. A lot of love and hugs from Dr. Ajay. Sister Tinuke Oyenuga says, thank you, Sister Bimbo, for inviting her. Thank you, all resource person. And Abby wrote, yes, Aman, and free of charge too. Kudos to the doctors. Dr. Lawyer Richard Williams says, Merry Christmas and Happy New Year in advance to all. God bless. Thank you, Ma and Pastor Tinu. I hope you find this season insightful. I hope so. Well, they said it did. And Haman interjected again that a truly safe and happy Christmas to all, and thoughts to those less fortunate in so many areas in the world. Let's hope for a better new year. Amen. Happy Kwanzaa. Amazing. Happy Kwanzaa. December 26th to January 1st. Wow. Dr. V says, wow, amazing, impressive. And Dr. Fawale says, thank you so much, Dr. Ajagbe, for another job well done. God bless. Wow, says Dr. V, great job. Wow, that is amazing at the Mission News. Thank you. And Dr. Fawali says, we thank God. Oh, thank you. Thank you, Dr. Fawali. Thank you. She says, more grace and blessings to me and the mission team. Thank you so much. We had an amazing mission trip. And on Sunday, we're having another medical missions. And now we've been invited to come to the market to come screen and take care of the market women. There's a lot of need in Nigeria, and we're grateful that the Lord has made it possible for us to do this. And thank you, Medical Mondays family, because you also contributed to make this happen. I am so, so blessed to have this family, Medical Mondays family. Thank you. My brother Jubi, Ogungbade, he was on the mission field too. Remember, from Pennsylvania? He came also in Nigeria. He was there and he brought some family members. He wishes us Merry Christmas and New Year in advance. Thanks to everyone. He's 77. He's in Nigeria like me right now. And look at the time, he's still up. Thank you, sir. God bless you, sir. Merry Christmas to all, and may 2024 be fulfilling and impactful for all of us. Dr. Fawale said, and also added that she's grateful for this platform. So am I. I'm grateful for you, sis. Will you stream any mission work? Hammond, well, we didn't stream it, but we can consider doing that. We do have videos, we have pictures, and I'll send some to you now that I have your new number. We have lots of videos and pictures. I'll send it to you all.
Have you already volunteered to share videos with him?
Oh, okay, cool. Thank you so much, and have a blessed night.
So,
Till we see next year. Oh my gosh, we'll see 2024 by the grace of God.
Yeah.
Amen.
Okay.
Amen.
If anybody still has something to share or ask, we'll linger for some time. Dr. O, you can go.
Actually,
Thank
I
you.
have something. Please share with me topics that you'll be interested in 2024, things that you'd like us to talk about so that, we can make sure that we address them.
Thank you, Doctor. I already sent you.
Also, resource persons. We need resource persons.
Resource
People to speak. Presenters.
Oh, okay.
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 Cool.
Yeah.
You're right.
Doctor,
There's a
I just want to
question.
acknowledge the Dohatis for showing up. Thank you if they are on platform. I am proud.
Well, they are sleeping now, I'll tell you.
Oh,
They showed up.
Dr. O.
I mean, I was so surprised. I felt like picking her up.
Actually, they came on
Dr.
last
O.
week. She came on last week.
It looks like Sister Kumbi is there.
She came on last week.
There's a question there about your mission community.
I see the question. I'm going to address it. I see the question.
Okay, thank you.
Yeah. Oh, I'm not going to miss it. So I didn't know